Today, I'd like to take a brief survey of the different areas we can look at helping with homeopathic remedies related to birth. Now, let me expand this out here. We have, uh, we have, of course, the very basic fact of life, or life and death, which is what unites us all, is that we're all born in one way or another. We all either come in through a natural birth or through a C-section or otherwise. And what we see in the clinic, of course, are many of the either the aftermath to the nature of people's birth or some of the anticipatory problems as people are approaching a birth event. So just to quickly go through here, I have some different categories laid out. So there's the phase of preparing for a birth, the pregnancy. There may be emotional aspects such as anticipatory anxiety, different fears, trying to mitigate external stressors, emotions such as guilt. The mother may often feel that they may not be doing enough in terms of their nutrition and the other preparations that may be necessary for a new baby. There's all the physical aspects that can come up, so things such as morning sickness, the mom's issues with sleep. Either she can't find a comfortable position the further she gets on in her pregnancy, or there's other things that are just making her generally uncomfortable. Her issues with kind of carrying that extra weight, issues around the back and the spine and so on. There can be physical issues with the baby, such as it being in breech position, and we have certain, again, homeopathic remedies that can help with that. Um, then when we get to the actual point of the birth itself, again, we may have different emotional aspects, whether of the mother herself or the father or other caretakers who are present. There can be just general anxieties about how the birth is going to go. They're something we have to deal with patients quite a lot. The more and more that birth becomes really considered a medicalized condition, and all of the really intensive medical interventions that are often used at or to prepare for a birth process. So the at the emotional level, we can have any range of emotions of the mother or the caretakers who feel that they're being kind of having any of these any of these medical interventions imposed on them, which is kind of against their wishes or against their desires for a more natural birth. We also have any of the above emotions that the mother is feeling will, of course, be directly experienced by the baby itself. As well as the actual birth process itself, we may need remedies to help in the case of a long and extended labor, so things related to physical, mental, or emotional exhaustion, general remedies for pain, other physical aspects of what's actually going on during the birth, remedies for that. And then we get into the whole range of treating for things that have happened in the past. So, as you know, when we look at a patient's timeline of shocks and traumas and we go backwards in a chronological order, sooner or later we get back to treating everyone's birth event. And as I say, more and more as birth has become a medicalized kind of kind of event, we're seeing more and more kind of intensive situations or kind of trauma situations that people kind of get born into as far as the how the sequence of their birth event went. So just some examples here. Even at the level of a very straightforward, simple, natural birth, if someone has maybe had a home birth or maybe they were on their way to the hospital, but the baby came before they got there. So, some of those kinds of situations. Even then, we're still looking at using the remedies arnica, that's just for the general physical aspect of the birth, any sort of exhaustion, any sort of exertion, as well as from the baby's point of view, the physical aspects of going through the birth canal and all the compression on the head, the pressure through the birth canal and on the nervous system and the spine. Then we also, as I mentioned, get into all the various possible medical interventions. So we have C-sections. There are different vacuum or suction methods if the baby isn't coming out easily. The use of forceps and the kind of impact or damage that can do on the baby's skull and nervous system again. The whole range of drugs that may be used. Of course, there's drugs for inducing birth, and then there's drugs for different, of course, anesthesia if there is a C-section or something along those lines. Um, we also have, let me just scroll over here to the right. From the baby's point of view, all the different shocks or traumatic aspects of being born in a modern hospital. So we have the situation of being born under bright lights, under the scrutiny of emotionally uninvolved professionals. Of course, not every nurse or doctor is emotionally uninvolved, but by and large, when it becomes a 9 to 5 job, it's hard to kind of keep that emotional involvement one birth after the next. The baby gets antibiotics drops right into their eyes at birth. Also, the vitamin K injections. For boys, the circumcision is quite a deep trauma, as we see when we treat that and remove that from people's timeline events. The vaccinations are becoming more and more insistent and earlier in the life cycle, and in fact, in the U.S., there's even vaccinations at birth, and that may soon actually be entering Canada as well. The emotional aspect of the baby being separated from the mother, whether the baby is whisked off to be put into an incubator if it was a preemie, or just for other reasons, if they're whisking the baby off just to weigh it and do all these standard medicalized kind of procedures. There's kind of an emotional gap there between that first moment between the mother and the baby, and so on. This is just a general example, but the more we go into people's timelines, the more we're seeing that we have to really ask a lot of different questions and find out what either the nature of someone's birth was, or as I say, if someone is preparing for a birth in the present tense, to help them prepare for the kind of birth they would like to have, or if they're worried of certain things being a possibility, to have them ready with those remedies at the time of the birth if they need them. And it's, as I say, one way or another, whether we're working now, in the present tense, or working from the point of view of looking back at the past and removing those shocks and traumas from the system. These are some of the considerations that we are looking at.